Well, my name is Dr. Travis Mize, and I'm a periodontist, board certified by the American Board of Periodontology. Originally practiced for 5 years in Boston, maintaining full-time private practice along with teaching part-time at Harvard School of Dental Medicine. It's a team sport. I can treat the gums, I can get everything back to health, but we have to work together as as patient and practitioner to ensure that that the disease doesn't come back. One part of the disease that we can control is the bacteria, the organisms that cause the body to respond to inflammation, that also release toxins and can affect the blood and get into other organs and systems. We can keep those down, but we also have to take into account that the immune system, and so the only thing we can do is keep things as clean as possible, which means coming to your appointments regularly so we can evaluate and clean and make sure that you're able to do those things at home too. And there's several different ways to go about keeping things clean, and it's not a one size fits all either. And every person, it's like getting fitted for a nice suit or a dress. We want to make sure that what we propose is going to work for you, and that's always something that, as time goes on, is subject to change after each appointment. But it is important that in order to keep the teeth in a healthy condition after treatment, that we are seeing you periodically for cleanings. And usually what we do is we alternate those cleanings with your dentist. Sometimes you'd be getting a cleaning like every 3 months, sometimes every 4 months. It really just depends on how well things are controlled. Some patients come to our office every 3 months, and that's in those severe cases. Sometimes we see them more frequently for cleanings, especially if you're a patient that has any type of underlying conditions, diabetes, rheumatoid arthritis, other types of inflammatory conditions that could cause more problems, and we understand that nowadays about half the population over the age of 30 has some form of gum disease, and so it's a lot more common than we thought. In recent history, the data that we're collecting has shown that it's a lot more common. So we want to make sure that we're screening everybody adequately. Make sure that if they have a family history of gum disease, that we're aware of it, and that we're doing everything we can possibly to provide the best service for them.
Great health starts with your smile. Schedule your appointment today with Dr. Mize at Sunset Periodontics and Implant Dentistry.